calls to order the special meeting of the Boulder County Board of Health to discuss the 2023 draft budget. This public meeting, no public comment for this one. This is a hybrid meeting per our bylaws. We're allowed to do that. But a lot of people in the room. Lexi, would you like to introduce folks?
Thank you. Yes, welcome everyone. And thank you to our Board of Health for being with us tonight and to everyone as we, mark a really important part of our process, our annual process, and review the 23 draft budget this evening. I'd like to suggest that before we get started, that we just have some quick introductions, as there are a few folks in the room that don't know everyone. I'm Lexi Nolan, Interim Director of BCPH. My pronouns are she, her, hers.
Catherine Palmer, Director of Admin and Finance, she, her, hers. Desiree Kazarosian, Finance Manager, she, her, hers.
Yes, I'm Rachel Freeman, pronouns she, her, and I am the Program Manager for the Tobacco Education and Prevention Partnership. I'm here for Heather Crate, who's the Division Manager for Community Health.
Bree Thomas, she, her, hers, and I'm the Business Operations Coordinator.
Ellie Hinch, Strategic Initiative Branch Director, she, hers.
Greg, do you want to go ahead?
Greg Thomas, Board President.
Getting tacos.
Lindy Hinman, she, hers, and I am a board member. I had a long day. That was really hard to conquer.
Landry Fagan, board member, she, hers.
And can we turn over to our folks who are remoting in?
Sure, I'll jump in. This is Morgan McMillan, she, hers, and Board Vice President. Thanks.
Daphne? Go to Joe.
Good evening, Joe Malinowski. I serve as the Environmental Health Division Manager.
Indira?
Hi, it's Indira Gujral, Communicable Disease and Emergency Management Division Manager, and I use she, her pronouns.
Jerry?
Jerry Neal, Budget Analyst, she, her, and hers.
Ramona?
Hi, everyone. Ramona Farino, CFO for Boulder County. Thanks for having me.
Welcome. Aaron?
Good afternoon, Aaron Pratt, Budget Director, Boulder County.
Thank you. Daphne, are you back with us? Daphne McCabe will join us as soon as she can. She is the,
There we go. Who's coming?
oh, there we go.
Now I'm on. Thank you. Hi, Daphne McCabe, she, her, pronouns Family Health Division Manager.
Thank you. So as a matter of introduction to our conversation this evening, I'd just like to say that this year's budget has been a special challenge, including the significant turnover of our budget staff in PCPH. I think you all know Catherine Palmer has had the longest tenure on the team because she joined in late January and was joined by Desiree and Jerry later in the summer. The loss of that institutional knowledge due to turnover, including the need to resolve conflicting and missing information in our budget, learn spreadsheet architectures, hunt down and correct broken links, and improve the budget system generally, has created a pretty challenging workload. And we really appreciate you all allowing us to move the budget study session a bit later in the year. This evening, we'll present information that represents our most accurate assessment of the budget at this time, recognizing budgets are a continual moving process as new revenues and urgent needs and hopefully minor corrections are identified. The slides, though, won't reveal the depth of work and care taken by Catherine, Desiree, and Jerry to work with our teams in ways that bring a new level of collaboration, accuracy, clarity, and transparency in our funding sources, our operations, and personnel than our teams have previously had. And I'd just like to take a second before we dive into the numbers and the minutia to make some space for one or two of our division managers to comment on their experience of the process and the outcome this year from that investment from their perspective as partners in budget stewardship. I don't know if we have any. Yep, Indira?
Yes, I just want to say a big thank you to Catherine and the entire team, Jerry, Desiree, Alicia, like the whole team has just been absolutely amazing through this. It has been not only a very collaborative process, but it's probably one of the first processes where we have had a real deep dive and that bi-directional communication about what our budgets look like. And the transparency goes a long way with building trust among a lot of the coordinators who have to manage this money. And, you know, for a while during the pandemic, we didn't know where the money was. So this is really I'm really excited to see this budget. I can't wait to get there. Because I think it, for me, in coming out of the pandemic, it really helps to set up that strategic planning and what we foresee in 2024, given all of the different fiscal cliffs. And I think Lexi and Bob did a great job last Board of Health, really talking about all the escalating crises that we've been through. And so I am just super grateful. The whole team, all of us are super grateful for this coming and giving us a new baseline and really identifying where we're at financially, so that way we can figure out our future. And so I just want to give a shout out and say thank you, because I know it was a lot of work and there were a lot of moving pieces with the county commissioners changing salaries and giving bonuses and, you know, all those things that make it really difficult to change all of the different budgets. So just big thank you to the team and Catherine.
Thanks, Indira. Daphne?
I'd love to echo that. The skill, the tools, everything that they've created has just been so empowering, I think, to everybody to understand where their budgets sit as coordinators, the decisions and the trade-offs that they might need to make. And I just want to thank the finance team for their commitment to accuracy and listening and going back and forth and the iterative process, and just really, really appreciate this opportunity to have a view of the draft and how it all pulls up together. So thank you very, very much. Really appreciate y'all.
All right, thank you for those comments. Catherine, the floor is yours.
All right, thank you. And thank you to Daphne and Indira for sharing those kind words. So first thing, Jordan, if you don't mind changing the slide, thank you. So we're going to go just briefly touch on the agenda. So we did our introductions. I'm going to touch briefly on the budget schedule, acknowledge where we are and where we're going. Then we will go through updates in current budgetary preparation process. We'll ask Ramona and Aaron to first provide some county updates. And then we'll go on to the BCPH side of the updates that we have seen on our end. We're then going to talk about considerations for the 2023 budget and then get into the data. We'll talk about the FTE changes, the programmatic budgetary sheet, revenue and expenses, get into some of the nitty-gritty in that space, and then we'll talk about finally wrapping it with next steps and any discussion that you all have. Can you go to the next slide? Okay, so really quickly, just taking a look at the timeline, which it's a moving target. I even think as we go through this process, I know before it was further in the summer, and again, appreciating the willingness of you all to allow us more time to do more study and clean up to get to where we are now. So we are where the black diamond is, acknowledging that is our budget work session with the Board of Health in this same month. We will also present the resolution letter to you to acknowledge our recommended budget. This month, when that is done, we will also work in OpenGov to finalize our budget request to the county, and then the county budget will be adopted. So just acknowledging how the rest of this year will wrap up. Any questions about the timeline? Okay, so next we'll shift over to considerations. And actually, we go back to the, sorry. Don't want to give anything away. Okay, so Aaron and Ramona, I'll turn it over to you to talk about the county considerations and the overall status and updates that have happened recently.
Thank you. Now let Ramon, you can start off as well.
Either way. Thanks everybody for having us here today. Thanks for inviting us. I'm actually going to let Aaron talk about the budget process and the economics of the county. We'll basically share with you what we shared at our recommended budget presentation to the commissioners and the public a bit earlier in October. And yeah, he'll go through all that timeline with you. I thought I'd just take a few minutes. I don't want to overlap with Aaron and just talk about maybe the accounting side of the house for a little bit, just some upcoming things that we'd like you to know. I hear you on all the turnover that you've had over there in public health, so we feel for you. And, we're here to help and, and you have reached out to us and we appreciate that. So we're here to help you out. Just wanted to let you know that we're going to have our first ever accounting summit. We've never done this in our office. So doesn't that sound fun? In the new year, after we, close the budget and, so it's busy year end, but that's the reason for having it there. We want to invite, your accounting staff to come on over. We're going to try to do it in person, probably up in the hearing room. And the agenda for that is number one, fraud awareness. I'm sure you probably all saw it in the paper, the $238,000 fraudulent check that was cashed and is still being investigated. So we want to do some more deep dives on how we can all best protect our funds and our county. We all just got cybersecurity classes that we all took online, through IT, but we'd like to do some roundtable exercises, have a little fun with it, and just make everybody aware. And that's not just for county folks, but it can be for anybody that works with contractors and suppliers, and it deals with this through an angle that they don't really see that they are, changing addresses, changing names, things of that sort. So that's going to be one of the agenda items. And then back to basics. I've talked to the commissioners about this. We've had the same pains that you've had with Oracle on the accounting side. We went live in 2019. We've been behind on our side as well. Public health is, but we have too. It's been difficult with Oracle to get our reporting in on a timely basis, and we've been out of sync with the state. We've been actually out of compliance now with the state since our 2020 audit. They've been gracious, but they do hold back funds when we're late. They're holding back funds again because we are late, but we're getting back on the time track now that we're closing out this year, this 2021 year, and we should be back on track for our normal audit cycles where we close our books on July 31st, which is the state deadline. The extended deadline is September 30th. That's still acceptable. We really want to start pushing again for July 31st so that your staff, my staff, everybody's staff can actually have summer vacations and have those downtimes where we're doing analytic work and things that never get taken off our desk. So I wanted to throw that out there because I know you all have new staff as well, but we'll talk about more of those deadlines. The commissioners will also be involved to just reiterate that we need to be getting back to adhering to the state deadlines and also our SEC deadlines and everything that's happened over the last couple of years. And if we could stop having disasters, that would be helpful too, right? I mean, that's the other thing. We were starting to get online, and Desiree was, working with us at the time. Obviously she knows about the Marshall Fire and all the, the cards that she was issuing. We had to pull off the audit for a couple months there too. So just wanted to, bring that to everybody's attention and just want to make that known that the invite will be coming out. Send anybody that you like. We'll probably have a couple different sessions, and we just want to, help wherever we can and have that collaboration. So I'm going to stop speaking because I think that's plenty of me talking at you, and turn it over to Aaron to talk about the actual rest of the budget season and the economy.
Yeah, the season. It's definitely a season. And thank you all. Thank you, Catherine and Desiree, for continue to work through with us on the budget process. Of course, we're implementing a new budget system. As Catherine mentioned, OpenGov is our new greatest budget system. We're finalizing that implementation, but as far as the 2023 budget process, we are almost at the home stretch. Next week, we'll be doing the work session. I understand that you withdrew your 2023 request. It's a bad year. 2023 is not projected to be any revenue growth in our major funding source for property tax. Just a little background: 2021, well, Senate bill in 2021 and a Senate bill in 2022 decreased our property tax revenue projections by considerable amounts. I think in 2020, for the 2022 budget, it was right around 12 million. And then projected for 2023, although this time the state is actually giving us some money back, it's still about $16 million. So we're basically flat over 2022 projected revenue, which is in a reassessment year. That being said, a lot of our requests have really stuck to the budget instructions. So there's a lot of things in the recommended budget, and the commissioners were really intentional about making sure that compensation is first. Compensation has always historically been last. The last thing that was actually approved as part of the budget process. So since that's first, it gave us the ability to understand what was still available, and then shorten the BOCC decision point list. I think it's right around $32 million worth of requests still pending that the board will give us direction on next Thursday. Yes, next Thursday. And after that, that's the finalization of our budget process. As Catherine and Desiree was mentioning, we'll actually pick up with you all to start implementing your budget into the OpenGov system. So then that way, your budget and our budget will be adopted at the same time and via the system. So January 1st, it will be your budget will be in the system, and then we can start creating your reports. So then that way you can start getting your dashboards and the department division level sort of data that you've been looking for that we haven't had because our budget system just was so great. So that's where we are in the process. What I've been telling a lot of departments and offices, 2024, if you can hold out until 2024, that's the year to make requests. That's the year to, put stuff in front of the commissioners, have the preliminary meetings. The budget instructions will, of course, again, come out around May. It'll go out to EODH, but that's the year to start to understand what do you need. And we should see growth because it's a reassessment period. And in that reassessment period, I think we're projected to get an additional, if the Senate doesn't change again, the residential assessment rate categories, at least $20+ million on top of our current base property tax revenues. And of course, we have sales and use tax for the county that's growing, but the major revenue source in which we fund you by is our property tax. So in the 2024 planning period, that's the year to make some additional requests. And then we can, at that time, the team can work with you because, unfortunately, I'm stepping out. The team can work with you in order to put those requests in the system, get the information back that you all need to see what funding sources do you are available to you all. So then that way you can make requests. So that's where we currently are with the process. Again, December 6th is our hard stop to adopt the budget with the board. Statutorily, that's December 15th, but hopefully after next Wednesday's work session, at least county side, we hope to be done with our budget, and then we can focus on public health's budget to then build it up to your projections, and then also create some dashboard and reporting.
Great, thank you, Aaron and Ramona. And I just want to take a second to say thank you, Aaron, for all the work that you've done with us, especially providing some historical knowledge around the work that we've been doing. And you've been such an asset to us. So thank you. And you will be missed. So, but we're excited for you and your new adventures. So
Thank you.
why Aaron and Ramona are here, or do you have any questions?
I do have a question about the fraud discussion. And I did get a call from an auditor as a board member about this. So I want to make sure I'm clear, and it doesn't have to be in this meeting, but I'd like to make sure I understand what the policies and procedures are around our budgeting process to prevent fraud. And, what we're doing retrospectively, current and prospectively, and what the role of the board is in helping to support mitigating fraud.
Mindy, can I address how we're handling the immediate?
Yeah, that would be great.
So the county came out with instruction, how they were going to follow up on vendor changes. And right now the Boulder County Public Health is mirroring that same protocol. So we can forward that on to all of you if you'd like.
Great. Yeah, and then if Catherine, if you can, and again, we can offline about this, just sort of help me understand how through the the budget review process, what safeguards are in place to ensure that, retrospectively or prospectively, we're not, we're catching fraud, I guess, is for lack of a better way to say it.
Yeah, we could definitely do that. And it's great to hear that you got that telephone call, Lindy, because Desiree and I were on the call with the auditors last Friday, and they asked us very similar but opposite questions of like, how does the board interact with these processes and policies? So
Yeah.
they're doing the full circle, and I think it's good collectively for us to be on the same page.
I think so. And if there's anything that we need as a board in terms of training, support, I think we should talk about that just to make sure that we're appropriately prepared.
Morgan?
It's fresh of mind for me.
I don't know if Ramona has something to add about fraud, because my question is not about fraud. So if Ramona wanted to add anything, I can wait.
Yeah, I was just gonna add in that, as Desiree said, it's not really, around the budget. You mentioned, fraud around the budget. There's very rarely any fraud around actually the budget process, because obviously you're not spending any money at that point. Most of the fraud that you're going to see, it's all cybersecurity, where things, you got to be really, really careful. Things are coming through email that look so real. I mean, it looks real. What happened here, it's unfortunate. It's a lot of, we got to keep communicating with each other, and our procedures were in place that anytime any vendor sends an email saying, change our name, we changed our to an LLC or whatever it is, change our address. Our procedures always have been for the last several years. You got to pick up the phone. No taking an email change. That's the biggest thing I can say. You always pick up the phone and call the number you already had, call a number you can find online, call the front desk of ABC company and say, hey, have you moved, or what's your remit to address? And verify it that way. And unfortunately, what happened here is a communication failure where 3 different people in a department had a vendor say that they want to change their name, their address. Each one of those folks thought somebody else called. So it wasn't anybody avoided, they thought somebody else called. So having some procedures in your own office of who is that designated person, not depending on other people. So what we have now, the new procedures that I sent out to everybody that Desiree's referring to, is anytime that there is a vendor name change, vendor address change, someone now needs to, on our form, certify that they have called. So basically, I mean, it's on the honor system still, right? But why would you check the box if you didn't do it? Check the box. I certify I called. Here's the name of the person I talked to. Here's the here's their number. We just wanted to bring it to light that it's been procedure, but it's we're all busy, right? And it falls through the cracks. So the biggest thing for fraud really right now is everything related to cybersecurity. So if you could mention to your staff, Ben from our IT department will be sending out more mandatory cybersecurity trainings. Please impress upon your staff to be taking those. I believe they are mandatory, and I think if you don't take them, you lose your access at some point. You actually lose your access to county internet if you don't take them. So, but if anybody on the board or anybody on staff there ever wants to talk to me directly about any concerns you have, I'm always open. Give me a call, shoot me an email. I'm happy to talk some more about that.
And thanks, Ramona. That was another question I had, is what is the formal training around this? And I guess there's a question about whether the board should be taking these trainings. I don't know if we are, and I've just not experienced that yet, but something to consider, I think.
Something to consider, sure.
Yeah, I don't know if that's appropriate or not, but.
Yeah, I think it's a good question we could ask the auditors too, like what their recommendations and suggestions are.
I think that would be good.
So Aaron, how long is the OpenGov? I mean, it seems like that's going relatively quick, and the Oracle thing never panned out, right?
I'm scared and shocked every single day just how quickly we've implemented and how smoothly it's going. So it's a out of the box sort of, and they use that terminology a lot, out of the box, but it's going really fast, it's going really well, and we are thoroughly we were so thoroughly happy that we're actually signing them on to do our budget book. So they're going to do our whole budget book creation, and they're actually doing it now, and we're going to be done by December-ish, whereas normally it would take us until June or July to complete our budget book. So we signed on for additional services for them just because how well it is.
All right, well, that's good news.
Yeah.
Morgan.
Yeah, thanks. I just wanted to clarify, Aaron, when you talk about the county, it doesn't sound like the county has necessarily seen a loss in property revenue, just that not an increase in property revenue.
No, so the valuations are still projected as increases, but what the Senate has done is, so the, for instance, residential assessment rate in 2020 was 7.15. So in 2021, they reduced that to 6.95. And now in 2022, they reduced it to 6.95. Now projected for 2023, they reduced it to 6.675. So
This is a population based, is that what it is? Sorry.
Yeah, across the whole
Okay.
county, across the whole state of Colorado. Yes.
Okay. Thank you. And so were property value or property assessments not affected or impacted by Marshall? Is that not impacting revenue for property?
It is. Yeah, it is
taxes?
impacting revenue. There's about 1,000 homes or businesses that we cannot collect on, so that's already factored into our flat projection. Because we collect 99%, we can have 1% uncollectible. That's where that Marshall Fire source to sit, the 1% uncollectible. And we just monitor in the course of the year how much revenue did we receive. But right now we're projecting just flat. Some of our dedicated property tax categories are seeing slight decreases, but they have fund balance to cover.
Okay, thank you. I appreciate that clarification.
Of course.
Okay, well, thanks, Aaron. Good luck.
Thank you.
Mona, thank you. See you next year or soon.
Yes, I'll be here.
See you guys. Thank you.
Thank you. Okay, so now that we've received that information from Ramona and Aaron, we'll shift into some of the work that we've done in BCPH specifically. So Jordan, if you don't mind. And we might, depending on how, we might zoom in just a little bit, just because it can be hard to read. Okay, sorry. No worries. We all have the documents in front of us, so I'm just saying that for me because I can see super high. Indira, you're. Okay, so when we were focusing on our updates in the budgetary process, we leaned heavily on two aspects, which Lexi talked a little bit about. So as you'll see, we created initially this phase approach of activities. And those two aspects that we leaned into were budgetary cleanup and then increasing our budgetary visibility with collaboration and participation. And what you'll notice as you look through some of the considerations that we had on the list on how we were going to do this is that we did have to end up swapping phase 2 and 3. And that's where we were going to have the conversation with you all first. So we initially started with providing the budgets out to the teams. We heard loud and clear that the teams had not been able to really see or function with their budgets and make decisions around those and acknowledge their needs. So we created initial documentation for them to do that, and then we were going to bring it to you and say, okay, here's where we are now. Let's talk about the budget session. And then take all of the information that we gathered, bring it back together, and then do a more in-depth review to get you to the budget approval process. What we acknowledged when we went through phase 1 is that there was a lot of work to still be done when we had the conversations with the teams. And it's been a wonderful experience, honestly, working so closely with the teams on the budget and being able to learn so much from them. And what it identified for us is that we wanted to be able to create a cleaner picture for all of you. So again, thank you. We'll say thank you 100 times, but it really has allowed us to test this process, make sure that it's working, and build these relationships and also give you a clearer budget. So these are, again, just a few of the considerations that we had. So now we'll move over to the actual work that we put in to the budget. Okay, so in this, we focused on 4 key areas. The key areas were funding, systematic, personnel, and compilation. Within the funding aspect, what we were really focusing on there with the consideration is gathering and wrapping our heads around all the different funding paths from our different sources. So how was the funding coming in? Were we ensuring that we received the funding? Were we acknowledging the impacts that we would see with all the changes that we had over the last year? Systematic, acknowledging overall formulas and spreadsheet cohesion. So that was probably, I will acknowledge, the most painful part of all of this, just to identify where things were tracking to and following the breadcrumbs multiple times over to make sure that we had it. Another big area that we did within here is there were conversations from the teams about wanting to have more autonomy with their budgets and being able to make more decisions about the things that they needed. So a couple of things that we shifted here were moving things out that were actually creating inefficiencies in our systems. So an example of that is in 2023, we will shift the bonus process out to the division managers. We'll still have some safeguards in place in case there's like a large ask. But right now what occurs is that all the bonuses come to me in my inbox is quite a scary sight. They come to me and then they also have to go to the director's team and we collectively on a monthly basis agree to them. And it really doesn't make much sense for me to be saying whether or not somebody in another division should be getting a bonus because I'm not working directly with them. So we're pushing that out and giving each of them their own bonus budgets so that they can make those decisions about the needs for their team and their staff and that recognition. Another area is we had a space called Special Projects, which was Org 12. And we, in our historical understanding of it, is that Special Projects budget was really created around the time of COVID, when leadership was in a fast reaction mode and said, we don't know where this lives. We're just going to create a new org and put it here. And understanding in that moment, that was the right decision at that time. But over time, it has created some tensions about who is able to manage and actually see that budget. So what we did within the 2023 is actually moving many of those funding areas back out to the teams, where there's an overarching team that really manages those sides of budgets. We have two that are going to remain in special projects, and those are still related to ARPA funding. So we have our county, which we call our BOCO ARPA funding, and then we received a workforce grant from the state. And again, we're looking at the 12 org now as umbrella grants. So a grant that really covers the entire department, not just one division or program, to provide greater oversight. Then looking at personnel, what we did in this is we did a ton of cleanup on internal personnel tracking, which was quite the work, acknowledging all of the different changes that were happening and had happened and where cleanup had not occurred. But then again, as we've mentioned within this conversation, it compounded with the county compensation changes. So we thought we would have it cleaned up and then we'd hear one more thing about the compensation changes and we'd have to start all over again. So that was an area that we also completed. And then what we did in the final column is just that compilation. So bringing it all together to then be able to address the 2023 needs of each of our programs. Any questions on those?
My question is, how are we factoring in kind of the strategic priorities of the work into this? Did that factor into the prioritization, or was this left more for the divisions to articulate? How did that work in terms of what we're funding fundamentally to deliver against in 23?
Yeah, so I'll start first and then Lexi, if you want to jump in. I think we looked at it from two different scopes. So one scope was we knew we were in a place where we really needed to get more structure underneath our budget to be able to support and speak to it. So a lot of the work that you're seeing here was focused on that element. The second element was to create more knowledge with our teams so that they could make the strategic decisions about where they were going and what was happening next. And Indira, thank you. She's not a plant. She actually brought that up. It's just an overall need that we have. And then that ties in nicely with the CHA and the strategic plan that's coming in, as we can have those conversations saying, we now know what our budget is, we have a structure, and how do we make the plans that we need in the upcoming year around these assessments that are happening in the plans that we're creating.
Okay, so it sounds like the process is to allocate the budget amounts and then determine what the priorities are to use that funding. Is that a fair?
I'll build a little bit on it. So what we've been kind of trying to do is develop some parallel streams of conversation so that as this architectural budget got built, that Kelly and her team are leading the strategic planning process and the conversations about strategic priorities, so that by the time we hit in January and we start making some decisions about strategic priorities, we're also looking at our exception requests from the team and using our reserve funding to think about what are the highest priorities within our exception requests that includes those strategic priority allocations.
Okay, and then, I'm sorry, I'll, one last question, but it sounds like there's a big chunk of the budget that is really funding what I'm going to call run the program, meaning there's not necessarily a reconciliation of those expenditures to say, you know, are these continuing to be our priorities? That there's just like a baseline assumption about what the department needs to run, that we are not necessarily reevaluating through the strategic planning process. The strategic planning process is being addressed through this separate amount of money that's being allocated for those initiatives on top.
I think that's accurate to say for 23 as a kind of a bridge year as we kind of get our system set up.
Got it.
But the expectation is also that in 24 and as we move forward, we are becoming much more strategic in budgeting. Kelly, did you want to add something?
Yeah, I just want to add to that.
Yeah.
I think part of this is 2023 is a planning year, actually. You know, we can't at this point really do that detailed planning needed that would build a budget, like a really good budget to go for. So we're looking at 2023 as setting that pace and that detailed strategic plan for like a 4 or 5 year. Right now, we're seeing a 4, but we're looking, Lexi and I are trying to talk to the state about pushing that out to a 5 year. And so when we do in-depth planning, they will include a budget with that. What do we need to do that work? What does that look like? And in some spaces, because a lot of the strategic priorities may be work we're already doing. So it's capturing that work and seeing where we have gaps as well. And then do we need to do additional funding with that? Are there spaces where we have zero funding, right? Like this was part of the issue when we had the mental health work that we had with our current plan that's wrapping up, right? There really wasn't sort of a plan put in place that had a budget behind it, and looking forward at sort of metrics and how we want to do that. So yeah, I think Catherine, I feel this is Catherine and Desiree and that whole team is setting us up a structure that'll allow us to do that work that we haven't been able to do to the past, that sort of planning and budget work that they intertwine with each other.
That's really helpful to understand. Yeah. Thank you. Appreciate that.
Any other questions on this? Okay, so we first talked about what we did. So now let's take a look at the data. So first thing, we'll start granularly and then we'll get better. So we wanted to talk briefly on the 2023 FTE changes. The amount that you see on the top left is when we met back in May, the figures that we provided to you then. And then the 2023 initial estimate, this amount is as of last week, when I pulled these figures again, just to make sure that we were on the right page. What you'll notice, I'll point you first to the year of 2020, where we had 146. We had kind of a really static number with a slight tiny increase in 2020. And then 2021, we see that response to COVID. In 2022, we're starting to come down. And then in 2023, we're starting to come down even further. What I would identify and forecast is that we will not go back to the 2020 numbers. What COVID identified for us is that there were more structural needs that had to be put in place around the FTE. But we also don't need the response rate that we had in 2021. So one of the things you'll see in the special projects line, again, that was created with the response to COVID. We're moving that to zero in conjunction with moving out the different funds so that the managers can better identify who their FTEs are and where they sit. The other thing that you'll note is that it then splits into areas like communicable disease. Their number goes up in that area because they had the largest amount in that special projects. We see some in admin and finance as well. I also just want to note that as of July 1st, 2023, that number is going to go down even further. That is when our ELC grant ends, and quite a few of those individuals that came on with us for the communicable disease response to COVID will no longer be with us because that grant will end. Any questions on this one?
Lexi, do we think that this enables enough capacity to respond to something that may occur in the future?
This is the question, right? This
Yeah.
is the question for everybody right now.
Right.
And it's not Boulder County Public Health. It's the
Right.
question with the state.
Yeah.
It's the question federally. You know, how do we prepare for emergencies in the future? And there is a very important conversation happening that intersects between emergency management and just basic public health infrastructure. And what do public health departments need? And so, you know, while we're not counting on it, we are hopeful that the number of conversations happening in that space around basic public health infrastructure is going to help reinforce some of those spaces, and it will be an ongoing conversation that we're having. Great question, though.
Yeah. So it sounds like we are evaluating that. We don't necessarily, this is a finite bucket of funding, so we're allocating the best way we can, but recognizing that there may be a capacity constraint.
Well, yeah, and I think also remember that we're also planning to do this workforce RFP that is really about how do we build our staff structure in a way that helps us to be better prepared for this kind of emergencies, has cross-training to better support emergency management, has backup plans for how we bring people in an emergency, but also really recognizing that, you know, prior to COVID, we had 2 epidemiologists. And, you know, I think that public health departments have to think about what is the necessary number. Did you want to add something, Catherine? Oh, okay.
Okay. Thank you. That's helpful. Sorry to ask so many questions.
Not at all. That's what this is for. Love it. But we can answer. We can ask questions.
Yeah, can I jump in? Thanks with the, so the estimate for FTEs, that's what, reflects a budget of what's in the budget. It doesn't necessarily reflect how many people are currently in that position, in those positions or in those departments. Cause I think that's another thing, right, that we've talked about is struggling with turnover or open positions that need to be filled. So this is what's been budgeted, but not necessarily how many folks are currently working in these departments.
Yeah, so great question, Morgan. So what I can tell you is that it is the strongest representation that we've ever had of how many positions that we have. And to get to the point that you're making is those are the positions that we have for each of those programs, but it also will include some vacancies that we have. The ones that we've cleaned out are positions where programs identified we do not have funding to fill that position going forward. So we're only looking at positions that the programs have acknowledged we have the funding that we're expecting to fill this position going into 2023. Okay, we'll move on to the next slide. This one, again, is a little bit bigger and is talking about the annual program change comparisons. This was one of the requests that you all had, was to see this a little bit more. I think Brooke might have been the one that asked for it. Unfortunately, she's not here. But if you want to take a look, the big thing that I would point out on this document is that you will note that there are 2 years where we are identifying a net loss. One of the years that we identified that net loss was in 2021. And obviously we understand why that's occurring because of COVID. The other year is this upcoming 2023. And the reason that we are initially identifying that loss, there's a multitude of reasons that we think it could be, but one of them has to do with the compensation impacts and how that's going to impact our overall divisions, and whether or not their grants are actually going to be able to cover it. The other thing that I would just acknowledge is that as we were doing this cleanup, it brings to light what the actual numbers were. And some of our programs were feeling confident in the information that had been provided to them in the past and making budget decisions off of the minimal amount of information that they were being given. So now we have to rein that in a little bit, showing transparency and coming together as a department to say, what do we need to do in this space to ensure that we're in a sustainable workspace, while also acknowledging the change that we'll see with gap funding possibly being covered by the county.
The county, can I just build on that a little bit? The county's communication to us at this point is, so you'll see later in the presentation, the county is about 40% of our revenues. And the expectation, they recognize that the salary adjustments are significant and create some pressures. And the expectation is that in Q3, we will be able to have a conversation, that each of the departments will be able to have a conversation with the county about what deficits were created by the salaries and work together on adjustments to fill those deficits.
Any questions on this one? Okay, so now let's go back a little bit. We'll go to a document that you all are familiar with seeing over the years. This is that revenue and expense.
Sorry, Catherine, one quick question just on the last slide before you, sorry, I'm just trying to look at all the numbers. So, so most departments are running at a deficit, it looks like, right? I mean, their expenses are gonna be larger than their revenues for 23. Is that, am I getting that? The slides are a little smaller on my screen. So how does that, and I know that has always been true of some departments, right? So some departments just end up operating at a deficit, but what is that something that is addressed through budgeting, like a planning for the next year? I know sometimes that just happens with, I'm just wondering what happens, what's the internal conversation around
so what we're
balancing
doing,
your department budget?
Yeah, so what we're doing this year is within our beautiful master budget spreadsheet. We've created another tab that is called grant deficits. And what we've acknowledged with each of the internal grant budgets that we work with the teams, where we're identifying a deficit, and what we're trying to acknowledge is whether or not that deficit comes from the salary increase or it comes from their actual operating needs. And right now I would say the majority of them come from the compensation increase. So because we understand that. Now, we do know there are some programs that we have that their funding over the years has stayed static, but their operating costs have increased. And so those will be conversations that we will have on how we can support those programs to be able to do the necessary work that they need to do, because they receive a lot of their funding from an outside funding source, but we need to be able to support them as well.
Can I just add one thing to that? Go ahead, Morgan.
No, I mean, it's helpful to hear because I know, as the board that's charged with sort of, I mean, fiscal oversight is one of the board's biggest roles. And so I always felt a little bit troubled by like our dependence on the county for 40% of our budget. And then of course, like operating on grants, those are also challenging, right? Because you're competing and sometimes those run out and, how do you plan for that? So anyway, I know we have, for that reason, reserves and we also can dip into those reserves, but we don't have that many reserves. So just thinking about strategically how we think about budgeting and program expenses. And I totally appreciate and completely value and support salary increases. So it's good to know that you're trying to separate that expense from other programmatic expenses, but just it's something that as a board member is troublesome sometimes to think about, is our dependence on the county's generosity with their funds too.
Yeah, just to add a little finer point on some conversations that we've been having. you know, I mean, the grants and the county funding, they both have pros and cons. And actually, we think having a balance is a healthy place to be because it can go either way sometimes. One of the things that we're discovering as we dig in is kind of some of the historical relationship and practices in relation to the county funding public health. And it's a little concerning. And we'll have more conversations in the future. I am planning to have conversations with the county over the next months about some of the patterns that we see about historical funding of public health and how it is creating some inequities between departments. So as an example, our operations budget has not been increased in 6 years from the county. And last year, when 30 FTEs were allocated to departments, none of those went to public health. We were asked this year not to submit any requests to the county, even though they are considering, what was it? Aaron said $32 million in requests from other departments. So those kinds of problems, this is exactly the kind of space where we really see an opportunity. We want to get our facts straight first. We don't want to jump too quickly. We want to make sure we understand what's really happening. But then we also may want to work with the Board of Health to make sure that the expectations are a little bit clearer going forward. And when Aaron says 24 is the year to ask for stuff, we want to have our ducks in a row.
That makes me so mad, and absolutely the board will support once we understand.
We need to understand first.
Absolutely.
Yep.
Yeah, and
Go ahead,
that
Morgan.
get, oh, no, just that gets to the, I know the board, we talked about this at the retreat, just, building maybe some better relationships with the commissioner, strengthening the connections for the commissioners to the work of BCPH, and just being sort of thoughtful and strategic about how we do that. So I think, the board is all really ready to support BCPH in doing that. And we want to follow your recommendations and lead on how you suggest we support your work in those efforts.
Appreciate that. It's just awareness right now, and we'll absolutely be circling back with you all.
So it sounds like 24 is going to be a pretty big year in terms of advocacy and planning and rationalizing our priorities. Okay.
And we want to make sure that we have, I mean, you heard Aaron say, the process really starts in May. And so that really gives us a sense of the timeline for really getting some clarity in the space.
Just one more thing about fiscal cliffs.
Yeah.
ARPA, ELC, they all fiscally cliff this year. So 2024 becomes huge for us.
Yep.
Does the state anticipate, or are they driven by the feds? But does the state anticipate, like ELC expiring at the end of June? Do they anticipate there will be unspent funds to where they reallocate and then extend that for perhaps the rest of the year?
The last I heard was they will take a look in December.
Okay.
To see how much money is left, to see if there are counties that can spend down.
Okay.
But they're under the same kind of federal requirements to spend down.
Yep.
But that's the last I heard from Nicole. I don't see anything about extending or anything like that.
Okay, thank you. And then does the counties, the commissioner's decisions for, you mentioned the inequities when you look historic, is there some like unrealistic expectation that you guys will just pull in whatever grant funding to make up any shortfall that the county funding would produce?
It's interesting, when we have these conversations, we get different responses depending on who we're talking to. We hear, well, public health practice was not to ask for money from the county, which I think is part of it. We hear that because public health doesn't give back our extra money at the end of the year, that the county doesn't feel like they need to fund us in the same way because they don't have the same level of transparency and ownership of the funds that they do with other departments. And so I don't really see this as, the county hasn't done us right. I see this as we need to understand and clarify what the expectations of our relationship are going forward so that we can plan properly and be transparent, inclusive, and really, I mean, we're really working hard to work with other county departments more, and we want the county to see that as part of our effort, and not see us quite so siloed off in the corner as this kind of stepchild.
All right, good, thank you.
Morgan has a question.
Sorry, yeah, last thing. Sorry, I know this is taking longer than, you know. One other thing that I just think about in, because this came up during Marshall response, not just for, I have no idea what was happening with BCPH internally in those conversations on Marshall, but thinking about just the capacity of the county to have to respond to, you know, a whole bunch of funds coming in from the feds and just all the demands for services increasing. And I know that also affected BCPH. And I know that that was leading to some conversations about more partnerships being built between counties in Colorado because we're all dealing with wildfires these days, or, you know, the pandemic's a little different because that was a global crisis. But just planting that seed or wondering if those conversations are happening between sort of metro public health agencies to think about how we might share resources or, you know, during times of need, like responding to something like a wildfire. Just thinking about that capacity question again. I mean, how are we all, especially, I mean, and we're a well-resourced county. So you think about all these like little counties that are needing to respond to major climate-related disasters. I think that is a lot of the future, right, of how local governments are going to have to just work a little more intertwined with each other to respond. So I don't know if that is coming up at all, but.
It is, Morgan. But I will say the conversations are very early. I don't think that, I'm not seeing a lot of leadership yet in terms of how do we begin to build those regional responses. But I'm starting to see some kind of, you know, circle backs to that conversation repeatedly. So I do think it's gaining momentum, and sometimes it just takes a bit. I think emergency management is a perfect example where we have experienced, you know, a 25% decrease in emergency management funds, even as salaries go up and our frequency of needs and resource needs go up. We've had a decrease in the amount of funding from the state. And that's a perfect space where sometimes, I mean, pandemic, not so much, but if it's something like a wildfire, that kind of sharing of personnel and mobilization at a regional level can be really important. And so I think people are trying to kind of wrap their head around like, where are those opportunities? But the conversations have not gained enough steam yet.
I appreciate just that. Thanks, Lexi, for a status update on where those are. I would love to continue to hear if things evolve in that space.
Yeah.
Okay, we'll shift now over to the revenue and expense comparison spreadsheet, which is the one that you are more familiar with and we have seen in the past. So again, this just takes the figures that we saw on the previous page in relation to the division and section breakout and moves them more into the revenue and expenses pools, and then identifies rather than showing you the recommended and approved, we decided to just show you what was the final budget, the approved budget for each of the years to make this spreadsheet not so tiny, and then be able to show you comparison to the estimate for 2023. Questions on this one? And we'll talk about these a little bit more in depth on the next two slides too. Okay, Jordan, if you don't mind going to the next one.
Sorry, Catherine, can you describe to me what fee is? I don't know what that line item is.
Yeah, so fees are, there are specific fees that we receive from our different programs.
Okay, so it's a catch-all for various fees that are.
Yeah, so we have like, yeah, vital records, consumer protection.
Body art.
Yep.
Medicaid.
Okay. Oh, that wouldn't be Medicaid.
Oh.
It's sorry, Indira, that was slightly different. Okay, so going to the next one, we'll do the funding sources. So this is just taking a look at the previous ones and giving you more of a percentage and then laying them out in row on what we're seeing, where the different funding is coming in. Any questions on this one?
Yeah, I'm sorry. What's hold funding?
Yeah, I thought you would ask. So I was just gonna wait and see if anybody was like, I know what that is.
You want to see if they were actually reading it?
It's actually reading it.
I know. Okay, so hold funding, when we're saying that, what we're acknowledging is that we have funding that we know is going to be coming in and we plan to use it. It could be the rollover funding. It could be funding that we're expecting from the state, like the additional per capita funding, but we haven't identified where it's going yet. So we identify where it's going and then we have some hold funding that we're using. It actually is part of the reserves in some way, but we're acknowledging like this hasn't been here in the past. This is here right now in this upcoming year. That's going to go into our reserves if we don't use it or allocate it the way that we're planning to. Any other questions? Any surprises by where the funding is coming from? Okay. So the next that we will move to, I'll first take your attention to the left side, is the expenses. So again, it's that previous column that we were, or spreadsheet two ago, just going in to provide some percentages on these three big block areas, which is what we're looking at when we look at the budget. So again, no surprise that our salaries and benefits are a major chunk of the work that we're doing. Then we have our contractual, which is when we're taking the funds that we bring in and we're working with outside vendors or providers to make sure that we meet the needs of our community. And then the operating, just wanted to identify what the top three are. So the top three that we have go towards client supplies, so items that they need. Operating supplies, I just want to acknowledge that operating supplies is not office supplies. So those are things that our programs need to actually be able to run their programs and provide the services. And then registrations and tuitions was the third highest this year. We did expect to see that because of the fact that over the last couple of years, our teams have not been able to do as many. So we want to see even more increase to get some of those licensure or other trainings that they may need in the upcoming year. I see Joe has hand up. Before we go to Joe, I just want to also acknowledge that there was a close tie between the third and fourth one that did not make it on here. But it is worth pointing out to you, it's noteworthy that the fourth item is rent. It's building rent. And our county operating is actually going to be affected this upcoming year. And it's a question that we have about what we will be receiving from the county in totality, because typically we go off of what our amount was in the prior year. Well, in this upcoming year, one of the things that Aaron pointed out to us, and it's the same across every single department in Boulder County, is that they used to provide rent subsidy. It was only supposed to be for 1 year, supposedly. And unfortunately, it went more than 1 year. And now they're saying that needs to stop because we can't continue to pay for it. And the programs and the departments need to pay for it. So that was something that we saw a subsidy. It didn't cover it, but it gave us a little bit of relief in terms of the amount of rent. So I can tell you that the rent cost that we are estimating going into 2023 is $190,000. And that covers all of our different facilities. So just want to also acknowledge a major area where our funds go in operating.
So that just goes to the county who owns the department who owns the buildings. Okay.
Yes. Or as somebody said to me yesterday, so the county gives us county operating funds, then they charge us rent, and then we give them back money. Yeah. That they just gave us. Which I thought was a fun way to think about it.
And I think it's a great space for us to say, you know, what is our footprint? What do we what is our relationship with physical space going forward, given where we are, so.
Have you guys talked to the county about that yet, or is that something that's coming?
So we've had some conversations. When I first started, I wanted to get, one of the teams I also oversee is Jordan Bullards, which is the facilities management team. And I wanted to understand where we were with our master plan and some of the lovely buildings that we have on this campus. And what they acknowledge with us is that we are at the top of the list in terms of buildings that need to be renovated. And yet or not 2023, COVID had a pretty significant impact on them and their budget. And so although they have a master plan, they're really not able to adhere to it and identified that we probably won't see any major facility changes for 5 years. So we are largely looking at minor changes that we can make things a little bit more comfortable. One of the big things that I have Jordan focusing on where we can pull ADA funds in is ADA accessibility. So an example of that is our front desk. If you've been into the front admin desk, that is a very high desk. It's not accessible. And facilities has been very open and saying you can use ADA funds to update this and actually make it a more secure desk.
I don't want to go down a rabbit hole, but I have a million I'm really just more curious about like existing services.
Yeah.
And what the economic value is to us in terms of this real estate and what are the potential options to monetize that?
I think part of that question as well is also where our clients are now after COVID.
Yes.
So more of them are reaching us virtually and we're finding them in different places and we're often going out to them.
Yeah, I think a lot of organizations are going through the same exercise, right? So I think that it's just an interesting fiscal question, obviously, not only from an expense perspective, but then potentially a revenue. I don't know if there's opportunities to make this a revenue opportunity as well. So.
All right. Joe, I did see your hand up. Did you want to say something?
My apologies. That was an inadvertent hand raise. Please continue.
No worries. Thank you, Joe.
Well, as long as Joe was interjecting, I mean, we'd love to get environmental health out of the garden level over. I don't know if you guys have ever been to the environmental health department, but it's kind of.
Floor, you mean?
It's in a basement. And it's this big open space and it's like, seems like we might be able to find some offices that maybe aren't occupied that those folks could use that are a little more pleasant to come to work to. So, I mean,
It's
just
not
stuff like
very- Not a
that.
very comfortable space, but I also heard they just designated our buildings as historical landmarks. So we may have
Which is not great.
difficulty.
In Boulder, that's not great.
That's not great.
They're not going anywhere now.
No, they're never going to be changed.
No. And you have to keep the original windows now, right?
As long as they're not vinyl.
Yes.
That's a challenge too, right? Because I mean, you can look at it certainly from the financial level, but with all your turnover and, the ability to build relationships. If you've been here 10 or 20 years, you're probably okay because you know enough people. But if you just started in the last year or two, I mean, you're only going to be able to get to know people through Teams or Zoom. And, it just, there's not the personal conversation in those mediums. So, I mean, I get it, right? It's, nobody likes paying rent. But it's, just one of the other things to consider.
Any other questions on the expense side?
I just have a quick question, Catherine. Did you say rent is back?
Yes. Yes.
Okay.
So we were always paying a portion of rent. We were just receiving a rent subsidy.
I think that came along at the same time as COVID. And now they're saying you have these expenses to cover. We can't indefinitely cover all of the department's expenses for rent because they're paying all of the costs.
I think historically, we had rent.
Right.
And it was charged to grants. So people who had grants actually paid the rent for the whole agency.
That's interesting.
Which felt very unfair to people who had grants. And then And then I thought Jeff had negotiated some magical thing and we didn't have to pay rent anymore. And so it will be good to have deeper conversations about what that looks like moving forward.
And I think the county is thinking about their footprint too. And, you know, does it make sense to keep all the properties, given that so many departments are hybrid? So more to come on that one.
Okay, so let's pop over to reserves, which I know has been on the top of everybody's mind, wondering where we are. So I first want to talk a little bit about how we get to reserves and that figure, and acknowledge the tumultuousness of that number. So doing this work and the many spreadsheets that we have, it has shifted many times. This is probably the most confident we're feeling, but recognizing that even when we come back to you with the letter, it could shift slightly. And that's just because the budget that we have is not exceptionally high. And so when you make tiny shifts or you make a shift of 100,000, you're going to see a pretty big change in your reserve amount. So where the reserves come from are acknowledging areas where we have savings. Also where we have rollover funds. We also take our initial fund balance from our most recent audit, and then we work it back from there. So we acknowledge things like Tabor funding. We have to make a line for that. We also have acknowledgement of any funds that we're going to set aside that can't be used for anything specific. So an example, or they can be used for only something specific. So an example of that is our consumer protection program. When their fees come in, we hold their funds. They don't go into the general bucket. They can only be used specifically for salaries. We also have an emergency fund, so that comes out of the bottom line. And then we have the overall costs. So those are just some acknowledgements of we start with our fund balance that we get from, and just an acknowledgement as well is right now, it's based off an audit. It's based off of our 2021 audit. So we're working a year behind. So when we get the figure, typically what happens is Desiree will pull that fund balance at the beginning of next year. It'll be our draft consideration because it hasn't been audited yet, but it'll help us get a general understanding of where we're sitting, because at that point, all of our expenses have been paid for 22. So typically that February, end of February area. So we're paying all of our 2022 expenses, and then we're acknowledging all the funds that have come in. That helps us identify that initial fund balance. This has also been a pain point for us in an area where our hands have been a little bit bound, because as an example of this, when I first started and we had a accounting manager, and I think it was May, and I said, hey, could you pull the fund balance for me and just let me know what it is? And she said, it's $230,000. And so the reason for that is because we either had funding that hadn't come in yet, or we'd paid a ton of bills. And it's this very much a point in time. It makes it difficult for us to have more of these strategic conversations. So that's an area that over this next year, we will be building into our system, is to make more educated decisions around the funds that are coming in, when they should be coming in, having those conversations with our funders, and also the bills that are going out, and monitoring them a little bit more closely so we can have educated conversations around what we think the fund balance is, rather than when we pull it and have that skill. So as of right now, we're looking at a reserve in 2023 of 2.3 million. That means that we have a fund balance of 9.3%. So that's comparing the 2.3 to our overall budget. Just some knowledge around reserve amounts, because they all shift depending on what type of organization that you work in. For government, specifically in Colorado, they suggest that your reserve amounts be 11 to 15%. We also know that recently the county increased their reserve amount. I think it's close to 20% now. And that was to ensure that they had more emergency funding if a situation like COVID or the Marshall fires were to happen again. So that was a recent change that they made. Within statute, the public health is required to keep a 5% balance. And then over recent years, my understanding historically is that Jeff made the decision to then boost that up to 7. It was never put in specific language, but that was a decision that was made. We need to keep it at least at 7. But then understanding the impacts and the increase in costs. And really the standard across the state of Colorado and in government is that 11 to 15%, and you don't want to go over 22. So any questions on the reserves?
Well, I mean, my obvious question is, should we increase our reserve amount for some of the things that we're talking about in terms of capacity planning? I just worry a little bit about all the headwinds. And if something big were to happen, which we seem to be experiencing a lot of lately, you know, are we really prepared from a budgetary perspective to flex? So I would feel more comfortable, I guess, personally being more at a standard hold, but you know, I think 9.3% is commendable. But I feel more comfortable in the standard range.
I think that's a really good question, Lindy, and I will say that when I came on board, Jeff's advice was keep it below 10%, which is interesting. I'm not sure why there's that misalignment. This is a space where I could learn a lot, I'm sure. And I think there's also questions about, you know, when there's an emergency, Boulder County Public Health is usually responding with the county. And if the county is bumping up its reserves for emergencies, you know, this is part of that conversation about expectations. Are those funds that we would have access to provide the public health part of the response to the emergency, or are we expected to kind of be on our own? Because that shifts what we feel like we need to.
And I think that uncertainty is why I'm saying, because we don't know, why I'm saying that I'd rather have a little extra cushion than not, I think. I know that's super painful because every dollar matters. But yeah, if that is kind of the going standard, again, I'm just questioning why we would be below the lowest range.
Yeah, and I think I can speak briefly to that, Lindy, just to provide some outside perspective. And I think it goes back to what Lexi was talking about with the visibility that the county has for us. And if I'm just reading between the lines of what Jeff was probably attempting to do, was showing responsible stewardship of the dollars and the ability to ask the question for more funding. But I think the ability that we have now is that the county has also acknowledged that their reserves need to be stronger. And they're having conversations with other departments in the county about their reserve amounts. So when Lexi talks about making sure that we have our ducks in a row when we go back for this conversation, it's also having a conversation with the other departments to say, what's a typical reserve that you have? How much do you put back into the county? And what are you comfortable and they're comfortable with you managing, so that we can have that conversation, open conversation, and say, this is what our reserve is. And this is why we manage to this standard.
Catherine, can I add one thing?
Yeah.
When I went to a national training this year, they were also addressing inflation as another reason to increase your reserves because of the unstable economy that we're in right now. So not just, you know, pandemics and natural disasters.
Yeah, go ahead.
No, go
No, every year we have the conversation about the reserve, right? And I mean, I understand about the thought about trying to make it higher, and certainly at a county level, I understand why 11 to 15 or, you know, maybe a little more is ideal. But you know, you got to think about, I mean, we went through COVID and yeah, I mean, granted, the COVID stimulus, whatever we're calling it, all the funding came, and so it didn't require us to really have to dip into the reserves. If we could have survived COVID at less than 10%, I don't know. I think we're pretty
that's
good.
my concern, Greg, is that I think there's a lot of uncertainty, right? Like we can't necessarily rely on what just happened, right? And
Yeah.
that's what I get. It's like hedging a little bit against the risk, which I think at the end of the day, we don't know what the risk is, so it's hard to hedge. And this is like incremental, right? Between 9.3% and 11 as an example. But I just want to make sure, like I'm hearing that in, you know, the middle of the year, we've got a lot of this funding draining out. And that was coming from the federal government. And, you know, if the federal government isn't there to support, if the county's not there, the state, and we've got something we need to manage too. I want to make sure that we're prepared, right? I mean, that's so, but this is a little bit of an arbitrary conversation, right? Like I don't know what the right number actually is, and none of us do.
I do want to cut, I know there's a couple comments, but I also want to just going back to Greg's comment, because I totally understand and respect that. I also want to acknowledge at what cost. Because what we saw is without, and this is just my historical understanding, is that without having the funds readily available and knowing what we were doing, there created so much tension internally between programs and conversations about what we could do and how we could do things. And we saw a lot of system breakdown and we saw a lot of relationship breakdown. So yes, we got through it. And now we're doing a lot of cleanup and repair.
And, because there's always an and, right?
Yes.
And this is what we do. And I think part of Jeff's perspective was that if our reserves are very high, we're not in a very good position to be able to justify asking the county for funds. And so this is where the clarity and the transparency and the expectations and getting us all on that same page are. So it's like, so we can ask the question. So if we're going to have a different kind of funding relationship, or if we're going to be considered in a different way that's more similar to other departments in the future, what are your expectations of us in terms of how we manage our money? And I think that, those conversations kind of go together.
Yeah, I was just gonna share a quick example about monkeypox. So Colorado did not declare monkeypox a national outbreak, so we got no federal funding. But the people who were responding on monkeypox were on ELC funds, they were on specific immunization funds for COVID. So they could not bill their time and effort to monkeypox, and there was no space to bill it to. So we had to create like a monkeypox. That's gonna have to come from somewhere. So I do think that we have to figure out creatively in the future, how do we, develop these systems to be able to tap into. But I do agree from a historic standpoint, and Joe probably has a better standpoint than me, that Jeff used to keep it around 7%. And I remember one year he went down to 5%, and that was so we could create a health equity manager position. And that was a big deal for him to drop it. He was very conservative, so it was a big deal for him to drop it down to 5%. So I don't know. I think, Lexi, you're right. It's just finding that balance with the county and figuring this out.
I mean, an interesting exercise, I don't know, I don't want to, again, this is probably quibbling over a few percentages, but I would like to know what it would have looked at like without any federal funding. Like what would have happened, right? Like how would we have, what if our reserves were at whatever they were during COVID, what would have been the delta? Because that's what I worry about, right? It's
That would have been like 8 million.
There's capacity over things that we cannot predict. There's so much unpredictability, and I feel like unpredictability is getting worse by the day. And so I'm like overly worried about this probably, but what I wouldn't want us to do is assume anything, right? Like we have to sort of assume that we would get no support if something were to happen like monkeypox. So anyway, yeah, I'll stop talking now.
So then, just so I'm clear, so you start the year with 2.3. And then when you factor in the request that can't come from the county next year. So then we'll spend almost 600,000 out of that 2.3 million. And then you'll of course have some left over at the end of next year that then feeds into the following year. But if you were really taking a truly conservative approach, you might say, we'll let it ride for a year, let that balance build probably over 10%, but then those priorities don't get funded out of reserve.
Yeah, I mean, Lexi said, I think a little bit what I was gonna say, but I think part of this also, like you said, it's hedging. If we, bump up reserve, we have to figure out what does that mean for the work that we're doing now? What do we cut back? What does that mean? I think another thing that's really important, this is my opinion, and it may not be shared in this room, is that, and there's some spaces where you don't have the money to do a response or do whatever, you can't do it, right? I mean, it's just the way it is, right? And so I think sometimes you have to think about it in that way, right? It's kind of like the translation the translator piece we have at the county right now. You want us to translate everything, but we don't have the resources to translate it. So we can't do that until we get the resources. I think sometimes that's a hard call to make, right, on spaces, but I think that's part of looking at this too, right? It's not just, so if COVID would have happened, we couldn't have done COVID.
No.
But we could have done the best we could with what we had, and we couldn't do any more than that. The expectation would have to be different.
Well, and their impacts, like if you don't do monkeypox, right?
Yeah.
The community is going to be at your Board of Health meetings requesting that you're giving money to support monkeypox. So you're right. I mean, we have to set some boundaries at some point, but and maybe it's not on all public health to be coming up with the solutions.
Yes.
Us stripping away our priorities, funding our priorities just to fund response doesn't seem, that doesn't seem fair.
I think what might be beneficial as well is just to at some point do a presentation on the reserve amount and acknowledge why that's a standard, because I do appreciate the examples that you've been giving, Lindy, because they're like, oh my, and we've been living them. But before those things were happening, a lot of that even has to do with risk aspects. Somebody gets in a car accident, or we have some data stolen, or we have the fraud check. Those are the types of things where we see rates increase, and we need to be able to respond to those when those happen. So in the past, that's typically where those numbers have come from, with a little bit saved for emergency response. But now we've kind of flipped the table a little bit and said, whoa, how do we make sure we're ready for this? And we also have this bucket over here.
And the economic factors that play right now, I just think is a very important point.
Okay, so the other areas that were on there that I know that we were alluding to just a little bit include some requests. So we have the BCPH requests and we have the program requests that have been submitted thus far. The BCPH requests are the ones that Lexi was talking about at the beginning, where we pulled those back.
Those were requests to the county. And we were advised to pull them back because the county only wanted to consider a particular group of requests, and ours were deemed not to fit that category.
Who made that decision, Lexi? I mean, who told you to pull it back before the commissioner saw it?
Well, I made the decision to pull it back because I didn't feel like we had enough clarity about what the expectations were to be able to mount a strong ask, and I didn't want to, I felt like we needed to do the homework a little bit more first. OFM.
Sorry, but who's playing defense for the commissioners? Who's telling you to pull your ask back? Is that the budget office?
Well, OFM had communicated to departments that what the commissioners wanted to see in terms of asks was no FTEs and only needs that were new statutory requirements. And so what we had proposed were things that are statutory requirements that have been unfunded mandates for public health for years, that are beginning to create personnel stresses because the responsibilities have grown and we don't receive funding for those. But because they weren't new statutory requirements, we were advised that those wouldn't be appropriate to present.
We were also told, and Lexi talked about this as well a little bit, is that the general fund was dry. They had already made the decisions about where the general fund was going. And so our request probably wouldn't be honored.
And it didn't feel, honestly, it didn't feel like enough money to use the political capital that way. I would rather us really understand what we're trying to do and to have some productive conversations so that we're all on the same page, and not just feel like we're going into conversations begging for tiny amounts of money, but that we have clarity about what the vision is, what the long-term strategy is with the commission. Yeah.
So if we go forward and just apply the BCPH request amount, that shifts our reserve down to 2.243 with an 8.7% reserve. The next area that we see is program exception requests. So this year, we started up front and asked programs, where do you think you're going to be short on your budget and what do you need? Thinking again in that more strategic manner, what are the things that you're going to need to move through this next year? I just want to acknowledge a couple things that we did not ask programs to do this, but they readily were there to answer the call and say, how can we shift our funds first before we ask? So they took a look at where they didn't need funding and said, hey, I can cough that up. I don't need that. Let's move it over to this one. So there was a lot of strategizing happening within the programs, and I just want to commend them for doing that work and give them kudos because that was not a specific thing we asked of them this year. We just wanted to get a look at what they thought their budget was, but they were readily making those strategic decisions about how could we shift them some things, what do we really need, and then at the end of the day, where do our requests come in? So we broke that out again for you all to see those big categories. So what we want to acknowledge within this is typically when we do the program exception requests, we try to keep it to one-time funding within the upcoming year. And that's just because ongoing funding can become unsustainable and continues to eat away at the reserve and takes away from new needs that we'll have in the future state. Now, I will say that some of these are ongoing, and that's in the personnel area where we've acknowledged needs, but have not been able to fill those for a multitude of reasons. Because like Lexi identified, when we came up with the BCPH request, we already had to tell people you can't bring certain requests to the door because they just need to be statutory. So people were already holding on to things that they needed. So then when we get to the program request, then they're like, hey, this is something I really need. So acknowledging if we were to approve just the program requests, not the BCPH, that would shift us to 1.9 million with a 7.6% reserve. If we decide to accept all of the requests that are listed there, it will move us to 1.8 million with a 7.1%.
So part of what we're thinking about going forward is to do that snapshot in January of what our reserves are, because there's a moment where that feels like the most accurate representation of our reserves. And to have a conversation in management team about the asks to the county, along with the program exception requests and the strategic priority needs, and to have an exercise in management team where as a group together, we begin to kind of prioritize those things as a group.
Lexi, it would actually be a little later.
A little later?
We don't know our expenses until the end of February. So I would say March to April.
Thank you.
March to April. Yeah.
But this is the draft budget.
Mm-hmm.
Then March.
March.
The final, where we then approve the final request.
That's typically going to be that April area. So we've had this conversation, discussed where our final numbers.
Right, the book's closed, you know what your number is, okay.
Yep.
So when we could approve numbers there, and then you have those conversations internally, you find out what your actual number is, maybe it's higher. And if it's lower, then we revisit that when we make the final budget.
Yeah.
I guess the question would be, is at that point, are things baked into the cake so that if we were to make any changes, it's disrupting somebody's, personnel?
I think we could break that out for you and
Okay.
acknowledge those changes. One thing I do want to say is that that list that's up there for the program request is not complete. We're actually having a meeting next week before we give you the letter to make sure that we've compiled all of them and everyone's are in there so we can see what the overall need is and the overall impact. We know there's like 2 or 3 that are probably going to still come in.
Okay.
And I think that there's some work, these conversations are not going to be, 1-week conversations in terms of like gathering the needs, how do we prioritize? So I think that we could start some of those conversations early in the year. And then when in terms of like how do we prioritize? And then as we get information about what our reserves actually are, that'll allow us to move more quickly.
Yeah, I'll just say philosophically, I'm really opposed to not having reserves that are at the standard. I'm very concerned about that. I'll just say, I don't fully understand the past decisions here. I think there's pros and cons for sure, and I understand the trade-offs, but I really do worry about not having some sustaining capacity built into the budget. So, it's hard to understand, like, it's really, for me, hard to understand. These are just numbers. Like, I don't understand what this actually is. And so I have to sort of say the dispassionate standard or statement that I think we should be at a standard reserve amount. Because I don't know what this is. So that's what's hard about this, but that makes, to get down to 7.1%, I'm starting to feel uncomfortable with that. But it's, it's subject to debate, and I'm not gonna be the final arbiter here.
I mean, I guess my it would be just going back to the county, like, this isn't personal finance, we're not a private company. Like, so we don't have the same pressures as you do at work, you know what I mean? So like, we need to have a better relationship with the county, because taxes are coming in, where are they going? And if there were a crisis, like the Marshall Fire is not just a public health crisis, it's a very
Right.
complex crisis that affects the whole county. It's not just.
Exactly.
Public health shouldn't own that. Public health can't own COVID, even though that is a health crisis, So, we pay taxes and so
yeah.
that needs to be, maybe this is the budget that you
And to-
need to keep, but
Yeah.
7% doesn't scare me, because we have millions and millions of dollars in the county that should bail out. You know what I mean? There needs to be a better relationship. We're
And
not a silo.
and
This isn't personal. This isn't a private company.
I think you're absolutely right. And I do want to be sure that you all understand that the county really was very generous with us. They gave us several $1 million for COVID from the ARPA funds. They gave us funding in 21 related to funding they received from the feds. So the problem I see is that it's ad hoc without an ability to plan. And so I think, if we could clarify what are the expectations and commitments to each other,
I think
it would
that's the
create a
fundamental.
lot of trust and in comfort and being able to decide.
How much do we have to manage versus like just this piece of this huge pie,
I think the political piece of the county is huge. There's a lot of strength in the relationships there, and we have new commissioners, and we're going to have a third new commissioner.
Yeah.
That I'm hearing, looking reports on how easy that third commissioner will add to the pie. So everything is changing for them too.
And we're planning some orientations with the commissioners. I mean, I will say that, Janet Peterson has been great about pulling public health in more, as we've kind of said, we want to be in these conversations. And so I've been able to get a lot more access to department conversations within the county. We have been asked to present public health's work to the commissioners, which I'm not sure we've done very much in the past. We still present in front of the commissioners, and bless their hearts, they are surprised at the work that we do. And that's just because we need to build that relationship with them and help them understand what our role is in them achieving their goals. And so those opportunities are spaces that I'm trying to kind of really step into to represent the agency, and that others are stepping into the connections between division managers on different pieces of work with different departments, I think has increased a lot. And those are real opportunities. So, the money is one piece of it. The relationships are a piece of it. The education and understanding about what value we provide and what it is we do by heck. Those are all conversations that we're trying to kind of pull forward.
So can we position this decision as we are going to hold to our 9.3% reserve amount? And there will be future conversations when we have better clarity with the county around these other requests, so that we're not committing to those requests. I don't know if this is even an appropriate thing that we are not committing to that tonight, but to say, we'd like to stick with this reserve percentage until we have better information.
Yeah. So what I would share with you, because our budget is such an incredible moving target, is that what I heard. Is that in the little amount of 2 weeks from now, when I will present the resolution letter to you, our numbers are going to look different. And the reason for that is because, and I had this further down, but I want to give tremendous kudos to our teams because they bring in so many grants. It is hard work to fill out the applications, to figure out how they're going to use the funds, to acknowledge their breakdown in budgets, and they go at it day in and day out, and it is incredible. And we have 2 or 3 more that we are just getting their internal grant budgets going right now that are going to be fairly decent. So in the next 2 weeks, we'll be adding those in. But I want to commend the team because of the dedication that they have to really understand that the way that their programs are going to function is by bringing those grants in. And it's a lot of hard work. So there's going to be more shifts. And so what I would suggest to you is when we bring that resolution letter to you and we'll have some more of those added in, that may shift that number a little bit more and make you feel a little bit more comfortable. And Lindy, frankly, me too, because I don't love the number. I think that will help us make a little bit stronger decisions in that space once we get a little bit more that out. Yep. Okay, so I'm just shifting slightly. So we have continued slight adjustments as we prep for the Board of Health resolution letter November 14th. We're going to complete the entry into OpenGov as we talked about. We have continued cleanup and work with teams on all those additional grants, and we're going to start mapping a more efficient process for 2024. So those are really our next steps once we get that resolution letter. That's everything. Questions?
It's awesome work. Thank you.
I appreciate it. Well, we appreciate your engagement and all the questions.
Do you?
No, we actually do. We actually.
It's my participation. Seriously, thank you so much, you guys. This has been an enormous amount of painful work. Truly. It's hard to summarize anything how bad this has been.
One thing I would ask for the November meeting, the next November meeting is, that kind of trend history of the reserve percentage. Jeff used to present that a lot.
Yeah.
Because we have been down as low as 5% and we've also been up to 10%. So it doesn't mean that that is a permanent ratchet down, right? I mean, it does go up again. And so I think it would just be helpful and any additional clarity on the reserve request, I think would help us in terms of prioritizing.
And I assume he kept that low so that you would have some ability to ask for more funds. If you held a bunch in the reserve, is that what his thinking was?
I think historically, public health has tried to have more arm's length distance from the county and not done a lot of requests. That's part of why I want to get that historical knowledge about not just what is the pattern of operating funds to public health over the last 10 years or FTEs to public health, but also how does it compare to what was distributed to other counties? I think that would be really
other departments.
illuminating. Yes,
other
thank you.
departments.
Other departments. I think that would be really illuminating to us to understand kind of.
Right, what would be.
Kelly,
No, you're.
I just a real quick comment, just related to that. I think the challenge, just in my position, I've been in my position for 8 years, managing these budgets. The federal funding has stayed the same. So 8 years ago, it might have been okay to have a bigger reserve because we weren't paying people as much. Our costs hadn't gone up, but the federal funding really has not increased. And so I think what we're dealing with is, we've got a lot of expenses and people are our greatest asset. And then that's going to impact our reserves going forward. So and I think that we just have to be, like, maybe that's an assumption in planning in the future.
Unless we get more support, right?
And I think that's part of the conversation with the commissioners, is like, that's.
Yeah, it feels like we shouldn't be as silent. I mean, I guess that was his strategy, but I'm not sure.
Yeah,
that's
and maybe-
the right way to go.
Maybe there's some opportunities, to hustle a little more. Because I think we're building a great vision. I think people really respect Boulder County Public Health. Part of the reason I wanted to move here was because I wanted to work for a public health agency like this. And I think that there are opportunities where we're leaving money on the table with funding partners,
Yeah.
with donors, that we could probably step up our game in that space.
You can save on rent.
And we can say,
That just seems incredibly stupid to me.
I'm conscious of time and that you still have an executive session. Yes, Kelly.
I just have a couple questions, a question and a little bit of a comment. So one of the questions I have is if the standard for LPHAs in Colorado is 11 to 15, I would be more interested.
County government.
County government. Oh, so it's not LPHAs even, it's county government. Because it would be interesting to know, like, LPHAs of our size versus like the Silver Thread or
Yeah.
Chafee or something like that, right? What does their reserve look like? What does that mean, right? And, I think that, yes, I don't want my staff to kill me in my sleep, but, there's also, you mentioned, Catherine, this today, there may be other sort of funding sources or grants to go after that, even for within our space to try to, get some things that we've never done that, right, really? So, not that it affects this big time.
It's a lot of work. Can I add like a 30-second comment real quick? My feeling or my concern is the reason that these conversations weren't happening about increases is because they don't want, public health didn't want to have the conversation about refunding what they don't spend.
That's right. I think that's part of
And
it.
I think that's really the elephant in the room. And we've seen the number that they estimated, which was 300 to 500,000 a year. That would have to go back to the county.
Is that from like county vacancies and like?
And for lack of people who don't take full benefits.
Yeah.
So we keep all of that funding.
So would that apply now in this current environment? Meaning,
If we were more transparent with them. that's what we would do.
They would- I think they would
I
expect
think
to
that's
go down.
something that we have to be ready to talk about.
They were overseeing the funds.
Yeah, I think it's something that we have to be ready to talk about if we're gonna go down that road. So I think that, that's in play.
Thank you,
Well,
Desiree.
Yeah.
part of that Jeff's philosophy was also put those dollars to work. Don't
Yeah.
save it for a rainy day. And I mean, obviously you do need a rainy day. And that's why we talk about not going below 5% because that's still over $1 million.
But I just saw notes from you all from 2020 for the 2021 minutes. And the conversation was had then that the county was going to require, starting in 2021, that we refund the money. And for whatever reason, that didn't happen and it hasn't happened yet. But that conversation already
So it could
happened.
happen anyway.
Yeah.
I mean, that might be something to also clarify, right? Like, yeah, how should we treat the reserves? Because if the idea is that we're trying to support, be ready for something, right? That I don't know.
To pay the money back.
Yeah, right. Then can we, that's interesting. Okay.
I'm conscious that Lindy has a hard stop
Yeah.
at 7:30.
I've been conversation
About us, so I just want us to skedaddle. Thank you so much.
Morgan,
Thank you very
you
much,
would-
everybody.
Morgan, please go to the next Teams meeting that I just sent you for the executive session.
Okay, thanks, Jordan. Thanks, Catherine and team, for all the work you did to prep for this evening and for the last several months trying to get your arms wrapped around the budget.
Thank you.
Thank you, Morgan. Great work, Catherine.
Desiree.
Mhm.
Jerry.